Hello and welcome to 6 Minutes. I'm Gemma Collins. With changes to the Better Access scheme coming into effect on November the 1st, we find out this week what the options are for GPs. The long-delayed Senate report on the government's proposed cuts to mental health services could finally be released on Friday. But with the cuts due to come in next Tuesday, it seems that GPs should start preparing for the worst. So what can GPs do to ensure they can still provide mental health services? We spoke to the President of the Royal Australian College of GPs, Professor Claire Jackson.
Well, the whole aim is that we don't want our patients to suffer, but frankly, the general practices across Australia are small businesses, and for those, particularly with a very large mental health service burden, are finding it very difficult to continue to bulk bill patients for mental health services, given the real cost of running a practice has increased above CPI, and often the practices have made commitment to mental health nursing additional staff over 2 or 3 years, and they just cannot reverse their infrastructure costs. Many members have contacted us, particularly over the last 2 weeks, with ideas about how they can best support their patients in a very difficult time, and also looking at their particular circumstances. So practices vary enormously from those who are in private billing arrangements and are passing on the full impact to the patient. So the patients will have to pay a gap, whereas previously the practice had accepted the full rebate as full remuneration for the healthcare planning. Other practices in areas where patients with a mental illness are not currently using GPMPs and TCAs for other conditions are looking to use those because, as you know, under the new arrangements, the remuneration for planning for physical illness is greater than the remuneration to the patient for planning for their mental illness. Other practices are looking at other mental health rebates for their patients and looking at mechanisms to utilise different mental health items to support their patients. And finally, some practices in very, very busy areas who are unable to continue to remain viable with the new arrangements, and where patients are not able to pay an increased gap or any gap at all, will be relying on their state-funded mental health services. Well, the college is very concerned about the impact on Australians whilst the cuts remain. But all we can do is lobby hard, raise the evidence around the impact of the cuts, and work with the very many stakeholders who share our concerns. The 1st of November will not be an end. United General Practice Australia is absolutely unanimous in this. It'll be the end of one chapter and the beginning of the next. However, we will have that inquiry result by next Friday, and United General Practice Australia will be reviewing that. And we need to just keep pressing the government and independents and other political parties around the impact of the cuts.
Well, we'll be keeping you informed about the outcome of the Senate inquiry through our newsletter and website, so keep an eye out for that. I'm Gemma Collins. See you next week.